All right, good evening to all our viewers joining us today. On behalf of Homeopathy 360, I warmly welcome you to today's webinar titled Hahnemannian View about Doctrine of Signature. The doctrine of signature has always been a point of curiosity, debate, and sometimes even misunderstanding among students and practitioners. Today, we will explore the Hahnemannian view versus current perceptions of the doctrine through Materia Medica. Why is it crucial to interpret this concept through authentic Hahnemannian references and the impact of misinterpretation on day to day clinical practice? This session is designed to offer clarity, correct conceptual grounding, and practical insights. It is my honor to introduce our esteemed speaker, Dr. Yashwantrao B. Patil, co-founder of Virgin Homeopathy and a dedicated torchbearer of the authentic Hahnemannian principles. He is relentlessly working on the campaign Mission Save Hahnemannian Homeopathy, ensuring that every teaching is backed by original references from the Organon and other writings of Dr. Samuel Hahnemann. He is the author of two widely recognized books and has also contributed as an author in the revised fourth edition of augmented textbooks of homeopathic pharmacy by Dr. D.D. Banerjee. Currently serves as HOD and professor at HMC Jalgaon, shaping the next generation of classical homeopaths. Without further delay, let us welcome Dr. Yashwantrao B. Patil sir to enlighten us on the authentic Hahnemannian view of the doctrine of signature. Sir, we welcome you today.
Okay, thank you very much for wonderful introduction of me. So thanks a lot.
Yes, sir. The stage is all yours now.
Yes, thank you very much. So may I know that my PPT is visible?
Yes, sir, it is.
Okay, great. So I warmly welcome you all. A very well-known topic, doctrine of signature. We all knows about this. We all know this in the perspective of Materia Medica and the actions of the drug substances in terms of its size, shape, color, odor, like that. So basically, from where these concepts came up, we'll see some historical background and then we'll proceed further. So what is doctrine of signature? As we all know, doctrine of signature is nothing but it's the imaginary relationship between the physical appearance or physical properties of the drug substance, like color, taste, smell, its size, shape, or appearance, its secretions of the drug substance, especially vegetables and other drug substances. So we all know that when Dr. Hahnemann was studying medical sciences or even latter parts, that time pharmacology was not that developed. So whatever the contemporary practitioners of Dr. Hahnemann was there, or the previous past stalwarts or medical faculties were there, they were trying to understand the relationship between the action of the drug substances with its physical appearance or its properties, because they were not aware about the actual action of the drug substance. Even currently, if you compare the current allopathic pharmacology or other pharmacology of the other medical sciences, they are also still considering these kind of properties. So before 200 years, at the time of Dr. Hahnemann, there were no clinical trials, there were no drug proving, there were no other ways out to understand the action of the drug substance. So many of the previous stalwarts, previous medical faculties like Paracelsus and some European physicians, they were observing the appearance of the drug substance, its physical properties, and they were trying to correlate its relationship between the action. So this was the actual scenario at the time of Dr. Hahnemann, sir. So how they were trying to correlate it and why they were trying to correlate it? Because at the time of Hahnemann, sir, they were not aware about the particular action of the drug substance. So most of the Materia Medicas at the time of Hahnemann, sir, was having the main important source of this. So doctrine of signature was the basic source. Action of drugs or the actual effect of the drug substance with some imaginary relationship between the drug substance and its actions. So basically, this concept came from the ancient literature. So physicians like Paracelsus or other physicians, they tried to correlate it. And later physicians, they tried to understand this correlationship and they wrote the Mathematicas like that. So we know that up till the time of the Hahnemann sir, even while he was translating the Mathematica, that means Mathematica was already there. They were using the actions of the drug substance or the drug substances according to this correlationship as indications. But the problem was there that this relationship was not giving the results routinely. So this was actually the imaginary relationship. It is mere a guesswork. So when Dr. Herman was translating the Cullen's Mathematica, we know that Dr. Cullen was writing that because of the tonic effects, that cinchona bark extract is curing the malaria. So that means he was also guessing something. He was also correlating something. That means they were not aware about the actual actions and they were not having any way out for this. That's why they were trying to explain the concepts about the actions of the drug substance through this correlationship. So what was their assumption or what was their understanding about writing this? So they were thinking that nature has given us some clues, some indications. That's why some of the drug substances are having that particular appearance, their particular colors, their particular extracts, and they were trying to correlate that particular features with the specific disease conditions or disease secretions or particular organs or some particular tissues or systems. And this was the very basic source, chief source of this Mathematica at his time. And accordingly, they have built up the Mathematica. And most of the physicians, they were referring this type of Mathematica to apply the drug substances on the patients to treat their disease. And many times we know that these kind of actions of the drug substance or this kind of imaginary relationship were not giving the results. Rather, patients were deteriorating more than getting benefited. And because of this observation, Dr. Hahnemann was firmly believing that these kind of Mathematicas are not useful. And that's why later on we know the story that he has left the practice, he has stopped the allopathic practices, and then he started doing some other works like translations or working in the chemistry lab for his bread and butter. So his sheer uh, disappointment is just because of these kind of literature available to him for the understanding of the drug substance and its action. So this is why Dr. Hahnemann has stopped the practicing such kind of uh, with such kind of knowledge, and he then converted himself or started doing something else for his bread and butter. So Hahnemann sir was basically unhappy with this. He was not aware, he was not actually happy with this kind of practices, such kind of Mathematica, such kind of literatures available. And such Mathematica were very routinely used by the contemporary physicians. And all these conditions making the physicians or their treatments, their modalities, treatment modalities more vulnerable, more harmful than useful. And that we all knows that what kind of treatments they were giving, like uh, they were using, considering that some imaginary impure blood is there, or some wrong substances get produced inside the body, and they try to eliminate it by giving the purgatives, by giving the emetics, by giving the sudorifics to produce the sweating or the salivation, like that. And for that, they mostly using some kind of vegetables in the crude form or some kind of chemicals in the crude form. And because of these kind of practices, they were not actually relieving the patients or his sufferings. They were more making them more deteriorated. Their patients are suffering more by the treatment than the better results or by the recovery. And all these conditions were there because lack of knowledge of the Mathematica or the drugs prevalent at his time. And this is the reason why Dr. Herman has left his practices. So one of the most important factor for him to live the practice was such kind of imaginary relationship forming in the Matra Medica. So we'll try to understand what actually was the relationship written by their Matra Medica. Our books are full of such kind of references, including co-relationship between the Matra Medica and the drug actions. So day to day, in the day-to-day readings, or even the most of the teachers, they are giving such references that such kind of remedies are having co-relationship between the action of the drug substance and its appearance or color, odor, shape, size, like that. So we'll try to understand what prevalently, currently, we are having the Matra Medicas. What is the opinion about the doctor signature? So most of the time, maximum teachers, they were teaching while teaching the Matra Medica, or while even teaching the even our subject pharmacy, they were telling that this is the correlationship of the drug substance with its action. And likewise, we are learning, or likewise we are teaching. But is it really true? That we'll see. So the things for which Dr. Henneman has denied or stopped us or restricted us, the same thing which he denied we are doing. So this was the misery, and this is the reason why I am trying to take this topic, or I requested the Homeopathy 360 team that I will going to take this topic. So we'll see what current Matra Medicas, or most of the literature of our Matra Medicas, what they are telling about the doctrine of signature, the relationship between the drug substance and its action. So we know that pulsatilla. So pulsatilla is the plant which grows in sandy soil. That's why pulsatilla is almost dryness is there, but still thirstless, because it grows in a very small quantity of water. So this is the correlationship, as pulsatilla plant grows in very small quantity of water in dry lands. That's why our sandy land. That's why this pulsatilla is having this feature, dryness of the mucous membrane without thirst. So like that. So another relationship between the pulsatilla is pulsatilla flowers are floating on the wind. That's why, and also they are actually having downwardly facing flowers. So this correlationship of appearance of the pulsatilla plant is correlated by our Matra Medicas, that pulsatilla plant, like pulsatilla plant, the persons with pulsatilla characters are shy. They are very timid, and they desire open air, or relieved by open air. So likewise, the features of the pulsatilla plant are correlated with its action. Then we'll take another example from plant kingdom, that's sanguinaria. So we know that sanguinaria plant is having, if we cut it and we extract the juice, it is blood colored or red colored. So assuming that the color of blood is looking like the color of the juice of the sanguinaria. So assuming that sanguinaria is having good action on the blood. So likewise, digitalis. So digitalis flowers are having red dots. So assuming this relationship that cells or your blood are having this red color cells, that's why is having good on the blood. So this is the correlationship. Kingdom is carbo vegetabilis. So carbo vegetabilis is, we know that it is prepared from the charcoal. When the wood is ignited or been inflamed, then we will suddenly pour water to prepare this charcoal. So, and when the charcoal is glowing, that time gradually the ashes get collected over this glowing charcoals, and that means if we see an upside from the upside, then it looks like just ash. But if we blow air, we will see that when the ashes get removed, so the glowing coal is beneath. So because of these conditions, we are correlating these carbo-vegetable features with its action. So carbo-veg is having desire for air hunger. So externally it is cold, but internally burning hot. So this is kind of relationship. Then Thuja occidentalis, we know that Thuja is the plant which are having the fruits which are directly adhered with the branches and which is looks like warts. That's why this is the king of the warts we are thinking or we are assuming. Then Euphrasia. So Euphrasia itself is a name, common name of the Euphrasia itself is a denoting that it's acting on the eye. So Euphrasia are having the black colored dots, looks like iris or a pupil. So we are considering that Euphrasia is having good action on the eye. So this is the correlationship. Then Gelsemium. So Gelsemium is the remedy which are having yellow colored flower. That's why it is having good action on the biliary system or the gallbladder and bile like that. When there is a disturbances regarding the bile or biliary system, then we can prescribe the Gelsemium. Likewise, Chelidonium. So Chelidonium is also having the same yellow colored juice. That plant is having yellow colored juice. So we are correlating that Chelidonium is a very good remedy for the yellow colored juice from our body, that is bile. But I am going to show you one example which from the directly from the Chelidonium, what Dr. Henneman is writing about the action of this kind of relationship and actual action of the remedy. Then we'll see one relationship between the belladonna and calcarea. So belladonna plant grows in the calcium-rich soil. That's why we are considering this belladonna is the acute of calcarea carp remedy. Or we can say that this is one the complementary remedy or chronic remedy for the belladonna is the calcarea carp. So same way pulsatilla we are correlating. Pulsatilla is acute or acute remedy and silica is the chronic remedy. Pulsatilla grows in the sandy soil. That's why pulsatilla is acute and silica is the its chronic remedy. So this is the correlationship. Then we'll see few examples from the animals. What our Matra Medica even today is telling us regarding the relationship between the Matra Medica and this drug substance and this action, its action. So lachesis, we know that very much suspicious. So lachesis snake is having black color stool. It is continuously protruding tongue, which is trembling. So the patients are having same features like that. It is having protruding tongue on and off. Then it is trembling like that. So this is the correlationship. Then Tarantula hispania. So Tarantula hispania is the Spanish spider, which is very sensitive to the sound, especially drumsticks. That's why Tarantula is having the symptom that it is very sensitive to the noise. So this is the correlationship. Then apismale and blata oriental. Apismale is also having the very stinging pain. So it gives the sting, and that's why the patient is having the stinging kind of pains. This is the correlationship. Then blata orientalis. Routinely, we know that blata means cockroaches. They are actually living in the narrow spaces in the houses, and that's why it is having the action on the bronchial tree. So, like asthma. So, this is all we know from our knowledge of the basic Matra Medica. And most of the Matra Medica and even our pharmacy, when we teach this topic, doctrine of signature, contains the relationship of this. And then this creates the image that, yes, our homeopathy is having or considering the action of the correlationship of the drug substance and its action. So this is the wrong interpretation or wrong message is being conveyed to the students, or even most of the teachers are teaching this relationship of doctrine of signature with its action. So, but is it really true? Does Dr. Henneman sir has using these or recommending these, or is in the favor of these concepts? That we are going to see from the few different references from his own literature. So we'll see first reference from the aphorism 110, Organon of Medicine. So what Dr. Henneman is telling. So we know that doctrine of signature, we know that this aphorism is belonging to the group of aphorisms which tells about the drug proving. So if we have to judge the action of the drug, the most marvelous way Dr. Henneman has given us is the drug proving. And from that source only we will understand how the medicines are acting, how the drugs are acting on the body, on healthy human beings, and we try to derive the understanding about the action of the drug substance from this drug proving. So we'll see what Dr. Hemant sir is telling in aphorism 110. So I saw, moreover, that the morbid lesions which previous authors had observed to result from the medicinal substances when taken into the stomach of healthy persons, either in large doses given by mistake or in order to produce death in themselves or others. So Dr. Hahnemann is saying that what was the ordinary source for the Matra Medica at his time was the toxicological action or the homicidal or suicidal attempts, and how that drugs are acting on their stomach or on their body parts. This action they are considering to prepare their Matra Medica, and mostly they are giving this drug substance in the large doses. So uh, my observations when experimenting with the same substances on myself and other healthy individuals. So Dr. Hanuman sir is telling about this. These authors give details of what occurs as histories of poisoning and of the proof of the pernicious effects of these powerful substances, chiefly in order to warn others from their use. So most of the Matra Medicas are writing such kind of poisoning or toxicological effects of these substances to denote or to restrict the persons that these substances are very harmful. So we should not use them as a medicine or as a drug, or if we have to use it, then we should be very cautious. So this was the intention to write down its poisoning or toxicological effects of the drug substances in their Matra Medicas. What Dr. Henneman says right further. Partly also for the sake of exalting their own skill when under the use of the remedies they employed to combat these dangerous accidents, health gradually returned. But partly also when the persons so affected died under their treatment in order to seek their own justification in the dangerous character of these substances, which they then term poisons. So it is just a justification. So why these kind of actions are included in our Matra Medicas in older days or older Matra Medicas? Because they are warning us about their use, or they are trying to justify themselves that these drug substances are causing them a very dangerous action, and that's why the person is going to die, and that's why that substances are called as poisons. But most important thing is now we'll see what Dr. Hahnemann sir is telling about such kind of actions or such kind of relationship between the drug substance. So none of these observers ever dreamed that the symptoms they recorded merely as proofs of the noxious and poisonous character of these substances were sure revelations of the power of these drugs to extinguish curatively similar symptoms occurring in natural diseases. Now, Dr. Hanaman sir is saying that yes, they have tried to justify their understanding about the action of the drug substance, but they are not actually giving actual characters, actual action of the drug substance. We are not understanding the actual action of the drug substance or the utility of the drug substances, poisons for our day-to-day practices. That these their pathogenetic phenomena were intimations of their homeopathic curative action. So we don't get any actions, we don't get any clue about their actions. And that the only possible way to ascertain their medicinal powers is to observe those changes of health medicines are capable of producing in the healthy organism for the pure peculiar powers of the medicines available for the cure of the diseases are to be learned neither by any ingenious or prior speculations. Now, Dr. Hahnemann is saying that we can get the mm, data or knowledge about the action of the drug substance only through the pathogenetic trials, means drug proving. So from that, we will collect the set of symptoms through the particular methodology of the proving, and then we will get the actual pure action of the drug substance. But what Dr. Hahnemann sir is right warning, so we did not get any particular knowledge from these kind of prior speculations, such kind of imaginary thinking, imaginary literature about its action actually. So what Dr. Henneman is saying that for the pure peculiar powers of the medicines available for us to cure the disease are to be learned neither by any of the pure peculiar in any of the ingenious or prior speculations, nor by smell, taste, appearance of the drugs, nor by their chemical analysis, nor by aid by the employment of the several of them is given mixtures. But main important point regarding the doctrine of signature relationship and its action is that we cannot get the proper understanding about the action of the drugs through this imaginary relationship between the drug substance and its appearance or a smell or a taste or the features of that drug substance. So this is what Dr. Henneman sir is telling. Means from this aphorism, we are been clearly indicated by Dr. Henneman sir that we don't get any particular instructions about the action of the drug substance by such doctrine of signature concept. Now we'll see another reference from the author's preface to this. So when we read the Mater Medica Pura in author's preface, volume 1, we are same thing Dr. Heyman is telling us. So I am not going to write a criticism of the ordinary Mater Medica, else I would lay before the reader a detailed account hitherto made to determine the powers of the medicines from their color, taste, and smell. So, in the very beginning of the Mater Medica Pura, in its preface, Dr. Henneman sir is writing that I don't want to criticize the ordinary Mater Medicas or the contemporary Mater Medicas which are prevalent or available at his time. But what he's saying that I will actually give the detailed accounts of the futile endeavors. Means the way they have formed the Mater Medica, the way they collected the knowledge about the drug substances is actually useless, futile means it is not useful. That I am going to tell you in the detail. Means if you read few experiences from the Mater Medica and of the answer, we will get this reference that the way with which they were tried to understand the action of the drug substance by their just color, taste, smell, means considering the concept of doctor signature is actually futile, useless. It is not useful to understand the drug substance or its action. So likewise, Dr. Henneman sir is writing in of very first paragraph of the author's preface. So again, we get this second reference where Dr. Henneman sir is actually criticizing or actually denying with references for the this useless concept. So we cannot understand the detailed action of the drug substance through just this, through mimicking or through applying this concept just by their appearance, color, odor, taste, their and regarding their actions. So this is what Dr. Henneman sir is telling in very first paragraph of the preface of the Mater Medica Pura in volume 1. Now we'll see another reference from the Mater Medica Pura. So if you see in the previous slide, we have seen that we very boldly were telling that chelidonium having the yellow colored juice, that's why that remedy is having very great action on the liver, bile, biliary apparatus, like that. But is it the opinion of the Dr. Henneman sir? So we try to understand this from his own literature. Okay. So he's writing in the Mater Medica Pura, volume 1, under the remedy chelidonium. The ancients means the previous physicians before the Dr. Henneman sir, he's utilizing the word ancients. So what they have done, the previous stalwarts, previous physician, previous uh, doctors who have formed the Mater Medica, they regarding that Dr. Henneman is telling. So the ancients imagined that the yellow color of the juice of this plant was an indication of its utility in bilious diseases. So the same thing we are considering right now also while teaching the Mater Medica under Chelidonium. Most of the time we are actually considering its action. We are actually most of the Mater Medica teachers they are explaining the action of the drug substance through its appearance, color, odor. So this doctrine of signature, Dr. Henneman sir is telling. Previously, before him, most of the Mater Medica and most of the stalwarts from the medical field, they were using this yellowness of the juice as an indication for the bilious disorders. So correctly, Henneman sir has denoted. Now we'll see what actually other stalwarts are writing regarding their explanation about this. So what Dr. Henneman is writing in the Matra Medica of the Chelidonium, the moderns from this extended its employment to the hepatic disease, and though there were cases where the utility of this plant in maladies of that region of the abdomen was obvious, yet the disease of this organ differ so much among one another. Now, what Dr. Hanuman sir is saying that if we are considering this concept that yellowness of the juice of the chelidonium, and because of this yellowness, we are giving for every disease of the bilious system, for every case, so this is not useless. This is not useful. So this is what Dr. Hanuman is saying that we know the concept of individualization. We know the concept of particular action of the drug substance, its signs and symptoms, producing capacity, while drug proving. And what they are considering, they are just considering the yellowness of the juice, and they are blindly giving drug substance, this chelidonium for every disease of the biliary system. But what Dr. Henneman is saying that, so there were the cases where the utility of this plant in maladies of the region of the abdomen was obvious. It is obvious that yes, this plant is having good action on the abdominal organs or the liver or the biliary system. But what he is saying, yet the diseases of this organ differ so much among one another, both in their origin and in their attendant derangements of the rest of the organism. But we know that not the same diagnosis, the patients, number of patients with same diagnosis don't have the same set of symptoms. And because of this, as they don't have the same set of symptoms, we cannot prescribe the remedy according such kind of principles like yes, just yellowness of the juice that plant is producing or that plant is having, that's why we are giving it for the bilious disorders. So this is not actually the methodology of Dr. Henneman or homeopathy. And that's why Dr. Henneman is saying that we cannot prescribe remedy on just such kind of analogy. Why? Because every patient with the same diagnosis like bilious diseases having different kind of set of symptoms, and we should consider that set of symptoms. That's why we cannot prescribe where here, as the law of simile, the first and foremost law is not satisfied. That's why we don't get the results. We even many times we don't get the recovery in the patient, then we are get confused as a physician. So what further Dr. Henneman is right, both in their origin and in their attendants derangements of the rest of the organism. Moreover, the cases in which it is said to have done good have been so imperfectly described by the physician. Now, Dr. Henneman is saying that sometimes it is giving, and they are saying that yes, this is the good medicine for the bilious disorders, and we should prescribe it. But Dr. Henneman is saying that it is actually imperfectly described. They are not telling that in every case of every bilious disease it is acting or not. And actually, if you see practically right now also, or at his time, or we can see the literature of the previous stalwarts or previous homeopaths, we'll see that he not in every case of the bilious disorder, chelidonium is giving the results. So this is what Dr. Hemant sir is writing. So the cases in which it is said to have done good have been so imperfectly described by physicians. So physicians are not telling that many times they are giving chelidonium for the bilious disorder, but they don't get the results. They are just telling that yes, in few cases they are getting the results, and that they are saying that declaring that yes, we get the results, and chelidonium is a good remedy for the bilious disorders. That means they are imperfectly describing such kind of things, that it is impossible from their data to tell beforehand the cases of diseases in which it must certainly be in use. So what Dr. Hanuman is saying that if we utilize such kind of data and we prescribe the remedy, then we don't get the certain results or certain utility of that results, that remedy in every case. Or we cannot prescribe in such a way because we don't get the certain results. And many times, many physicians are aware about this. So we are prescribing such a remedy and we don't get the results. Just by understanding or considering this analogy about its appearance or yellowness of the juice and this action on the biliary system. So this is what Dr. Henneman is telling that is impossible from their data to tell beforehand the cases of diseases in which it must certainly be in use. And yet, this is indispensably necessary in the treatment of the diseases of the mankind which are of such serious importance. Now, Dr. Henneman is saying that if liver is getting involved, if biliary system is getting involved, so it is very serious condition. and it is very important for the patients to consider such in serious condition. We cannot think about very lightly. Just Telonomyces juice, and that's why we are giving chelidonium for every case. This is not good thing. So this is what Dr. Henneman sir is warning us. Hence, a recommendation of this sort is of but a general, undefined, and dubious character, especially since this plant was so seldom given simply. So Dr. Henneman is saying that such kind of practices are actually not recommended. These are undefined. We cannot get definite results with such results. And these practices are actually dubious, means useless, or many times which are not giving results. That's why actually Dr. Henneman is rejecting such kind of practices. So we'll see further what he is saying that. Yet this is indispensably necessary in the treatment of the diseases of mankind which are of such serious importance. Hence, recommendation of such this sort of is of but a general, undefined, and dubious character, especially since this plant was so seldom given simply and singly by the physician. We know that at the time of Hahnemann sir, most of the time the physicians were using remedies in combinations. They were not giving this medicine as singly. So they are not only giving this yellow colored chelidonium medicine for the village disorders, but they are adding another yellow colored flowers or plants. They are having such kind of characters, juice like yellow colored or flowers yellow colored, and they are making combination and giving it. But almost always in combination with the heterogeneous powerful substances and along with the simultaneous employment of so-called bitters by very so much in their effects. So they were not aware about its action, but still they are prescribing it in combinations. So likewise, Dr. Hemani sir is explained, means indirectly he is restricting us to utilize such kind of imaginary relationship while selecting the remedy. But God only knows how many of us are considering this or how many of us are teaching like this, considering Hahnemanian opinion and utilizing the knowledge of Hahnemann sir in the right way. The importance of human health does not admit of any such uncertain directions for the employment of the medicines. Now, Dr. Hahnemann sir is actually restricting us, warning us that we cannot, he is not allowing us, as the human health and human life is very most precious thing for us, that we cannot utilize such kind of uncertain directions, such uncertain directions or employment of the medicines. So we cannot limit ourselves. We should not limit ourselves for the selection of the remedy is based on such futile or such less useful concepts, because human health is most important. So it would be criminal frivolity to rest contented with such guesswork at the beside of the sick. Now, Dr. Hahnemann sir is calling us or calling them as criminals who are using such limited data for the prescription, for the selection of the remedy. So he is calling it as a criminal frivolity. So only that which the drugs themselves unequivocally reveal of their peculiar powers in their effects on the healthy human body. Means further, Dr. Henneman is saying that we just get the knowledge about the pure actions of the drug substance through the drug proving on the healthy human beings. And from that only we will judge and we will get the knowledge about actual action of the drug substance. So as a source of the Matra Medica or as a consideration or understanding the action of the drug substance, we should solely believe on the or rely on the drug proving data. So this is what Dr. Henneman is saying. That it is to say only their pure symptoms can teach us loudly and clearly when they can be advantageously used with certainty, and this is when they are administered in morbid states very similar to those of they are able to produce on the healthy body. Means Dr. Henneman sir is warning us that we should not use such undefinite data, and if we use it we don't get the certain results, and this is one of the reasons why most of the homeopaths are failing in their practice, because our Matra Medica is full of such imaginary data And most of the physicians, most of the beginners, they are utilizing this data for the selection of the remedy, and they are employing this, and then they are sheerly failing, and they are saying that homeopathy don't have results, or they have to make many trials and errors to treat the case, or many times these patients get even died or get spoiled in their health. So all these are happening because the wrong understanding about the doctrine of signature or its application in the practice. And our matramedicas are full of such wrong data. I have not seen even a single book of matramedica, even the pharmacy, where anybody is telling that such kind of selection of the remedy is denied by Dr. Haneman sir, restricted by Dr. Haneman sir. And he has given such instructions that we should not utilize this. If somebody is utilizing this knowledge, this concept for the selection of the remedy for the patients, that means he is doing some criminal offense. So likewise, Dr. Haneman sir is reprimanding us. So this is the reason why I choose this topic for this today's webinar, so that we will understand the Hahnemanian guidelines, Hahnemanian concept, what he has restricted, what he has denied not to do. He told for us that we should not do it. The same thing we are doing. And then we are getting failures in our practice. And then we are, most of the homeopaths, those who are using this concept, getting confused, or they are not getting confident prescriptions. They have to do trial and error. So like that, we are actually getting failed in our practice. So what ultimately conclusions are? Dr. Hahnemann was not happy with the sources of the knowledge of this kind of information which he was getting from the contemporary matramedicas or the practitioners who were practicing at his time or before him. So this is for sure. And that's why Dr. Hahnemann is restricted us from using this data. And the reason why he left the practice. Then if we see the different references from the Hahnemann literature, even most important reference where Dr. Hahnemann has very elaborately write about this, we have seen one reference from Organon of Medicine, F2110. We have seen another reference from the Matramedica, its preface. Then we have seen another reference from the Chelidonium, from the Matramedica Pura. Then we will have another more important reference, which I have actually just mentioned but not elaborated it because it is in the very detail if we have to study it. That was one chapter written by Dr. Hahnemann sir in Matramedica Pura, Volume 2, that is examination of the sources of the common Matramedica. So he tried to study the contemporary Matramedicas for the understanding of the action of the drug substances. And after studying all the different literature books on Matramedica, he came to the conclusions and he write it in a very long chapter heading examination of the sources of the common Matramedica. So this chapter actually contains almost 25 pages. So every homeopath must read it before teaching this concept of doctrine of signature. All the I would like to request all the Matramedica teachers and all the pharmacy teachers or the students, those who are listening this, that they must read this article or the chapter which is there in Matramedica Pura Volume 2. And the name of the chapter is Examination of the Sources of the Common Matramedica. So there he is, many times he is criticizing that this is not the source on which we can rely for the selection of the remedy or to understand the action of the remedy, because it is not going to get us the definite results. This is actually misleading. If we use such kind of practices, such kind of concepts, then we will get confused. So we are not understanding the endeavors of the drug proving of Dr. Hahnemann and its few others. So if we are considering such kind of imaginary relationship for the selection of the remedy in the practices, if our teachers are teaching this imaginary concept to correlate the understanding about the action of the drug substance with their appearance, then we are not actually understanding the why Dr. Hahnemann is denied us this Hahnemannian view. or why Dr. Henneman has rejected such concept from his literature at many places. So we are not actually following his understanding. And knowingly, unknowingly, we are actually getting confused. We are actually making our students confused. And those who are practicing based on such kind of imaginary data, they get failures in their practice. And what Dr. Henneman has asked us not to do, the same thing we are doing. And just imagine ki, if we are doing such wrong things, how we are going to get the results, how our students are going to get successes. And most tragic situation is that our books of Mater Medica, pharmacy don't teach this what Dr. Henneman has taught us, what Dr. Henneman has written many times in his literature, that we should not rely on such imaginary concept. So few reasons are there, because we cannot understand the actual action of the drug substance through this imaginary system. And another reason is our remedies are having so extensive action. If we consider chelidonium, so chelidonium don't have the action only on the biliary system. It is having action on all the systems of the body. So we are restricting ourselves to use the chelidonium just for the biliary diseases. So if we give the chelidonium for the biliary diseases, we don't get the results in every case because it is not similar always. We are actually rejecting our basic principles. We are not following that. And another point is that our remedy chelidonium is having so extensive action that we are limiting ourselves. We are just imaginary. We are prescribing that remedy or selecting that remedy just based on that imaginary data. So we are limiting us. That means we are actually not understanding the enormous work done by our provers, or those who have conducted the proving, and they have collected the data of drug proving and compiled it in the form of Mater Medica. So we are having very extensive proving of the drugs. If you study the chelidonium or any drug which we have mentioned under the chelidonium, under this doctrine of signature concept, that drug is having enormous action on other systems and other organs. So we are just restricting ourselves to utilize that particular remedy based on that particular concepts of doctrine of signature. So this is the injustice of the work with the work of Dr. Henneman and other stalwarts like Dr. Constantine Herring or Dr. T.F. Allain or Dr. Hughes, or all those who have conducted such provings meticulously with very hard work, and they compiled it, and they have made us that availability of their mathematicals. But unfortunately, most of the teachers, most of the books don't have these references. And that's why from many years, this concept is been taught that this is the useful concept. We should prescribe according such concept. And we are actually neglecting Hahnemanian instructions. So what Dr. Hahnemann is saying that it is criminal offense if somebody is prescribing based on such data. That means we are becoming criminals in view of Dr. Hahnemann, sir. We don't have any right to call ourselves as a genuine homeopath, as a homeopath. If you compare, if you see ourselves in terms of Dr. Hahnemann, sir. And this is the reason why I started my first webinar with this topic, with this Homeopathy 360. Very recently, I have sent one of the two of the articles to get included in this fourth revised edition, so that our homeopathy fraternity will get aware with this, and they will not do such mistake in future and future generations of homeopaths. So if we do such practices, our practice become indefinite, confusing. And to remove such confusions from the upcoming homeopaths or the generations of the homeopaths, we must include this data of Hahnemannian concept about the futility of the doctrine of signature. So I request all the teachers, all the faculties, those who are teaching organ of medicine, those who are teaching homeopathic pharmacy, those who are teaching Mater Medica, they must consider this Hahnemannian opinion, what he has very repeatedly telling. If we see the references from the organon, Mater Medica, from the lesser writings, we will come to know that throughout the life he was actually rejecting this concept. If we see evolutionary history, if we see the years of publication of that particular remedies or publication of that particular mm, concepts year by year, we will come to know that Dr. Hahnemann was never in the support of this concept to get utilized in the homeopathy. But unfortunately, most I have not get even a single book, not even a single practitioner who is actually teaching the same concept what Dr. Hahnemann has taught us, what he has repeatedly wrote it in the his literature. So it is our foremost duty that whenever we were teaching any concept to any students or in the classroom, we must try to refer the Hahnemannian literature, whether Dr. Hahnemann has told the same thing what we are teaching or what our books are contained, so that these wrong concepts, very indefinite concepts, very confusing concepts get eliminated from our literature, will get eliminated from our knowledge, will get eliminated from our understanding of the homeopathy, so that we will get more better understanding, so that we will get more definite knowledge, so that our homeopaths will succeed in life and they will be having marvelous results in their day-to-day life practice. So thank you very much.
Thank you so much, sir, for sharing deep knowledge and unwavering commitment to preserving authentic Hahnemannian teachings. A discussion much needed among students and teachers and practitioners. And I hope this will be an enlightening session. Sir, there is a question. Can we take it?
Yes, definitely.
Dr. Y. N. Rao is asking, is there any literature other than that of Dr. Hahnemann on the doctrine of signature?
Uh, to my opinion, as a homeopath, foremost thing for us is to just refer the Hahnemannian literature first. Why he is rejecting or why he has actually denied to use this concept. If we understand this, this will be more useful for us to utilize in our day-to-day life the correct knowledge of Hahnemann sir, which will get us certain results. If we see the reference from aphorism 53, Dr. Hahnemann is saying that there is the only way which is possible to human physicians is true mild cure, which is possible to us is the with homeopathy only. So are we that much certain? If we don't have that certain results, we should find out the reasons in our literature, especially from the Hahnemannian things, Hahnemannian literature, and we should try to understand what he wanted to tell us, whether we are following it correctly and completely, and we should rectify it. This is what I think. Rather than referring many more literature from other authors or other stalwarts, this is what I think we should refer.
Absolutely right, sir. We have one more question by Dr. Maninder Kaur. What books should we read
Yes.
as many new provings are coming up with many new symptoms every day? So she's asking for reference of such new provings.
Okay. If we see our evolutionary history of our homeopathy in last 200 years, so we will get most authentic data of proving from Hahnemann sir, which is the foremost first number reference books for us to understand the provings of the drug substance. Later, we will have more inclusion of the drugs, which many of the stalwarts they have included. They have enriched our Matra Medica, like hearing aiding symptoms, then T.F. Allen sir, provings, Encyclopedia of the Homeopathic Matra Medica, then Richard Hughes, who have also done the more proving with Hahnemann sir, and later he himself. So, if we study this much literature, I think this is more than sufficient to utilize this data for day-to-day life. So what happening in current day, what is definitive data is available to us, we are not actually paying attention towards that, and we are running behind the recent day literature or recent provings, and we are missing more extensive data what is available to us, which are very authentically proved, and we are running behind something else which is more indefinite, more uncertain, and that's what most of the homeopaths are getting failed in their practices.
Absolutely right, sir. Very well said. And thank you so much for your time. And I hope that the audience have got meaningful clinical learning in this session. Thank you for your time, sir. Thank you, audience. And I hope that you will be able to see this complete session again on YouTube on Homeopathy 360 channel. We are always looking forward to such insightful sessions, and sir has been very kind to give us time. Thank you so much, sir, and thank you, everyone.
So thank you very much. To the conclusion of today's session, I would like to request all the viewers of today's session that we are conducting online sessions to understand organon in a better way, to understand Hahnemannian concept with the reference from his own literature. So after studying different kind of practices, different methodology, different books, whatever prevalent in our medical field, especially in homeopathy, we have concluded that we have studied all the literature other than Hahnemann sir. And I am confident that I don't think that any one of you have read Hahnemannian literature completely and you have actually understood it in Hahnemannian way, in a correct way, and you are applying it. I don't get even a single person from our homeopathy fraternity, even older days and even recent days, that he is quite confident that he has understood the Hahnemannian literature correctly and he is applying it completely. So I think in last 200 years, nobody has tried to publish even the seventh edition. Nobody has said that Dr. Hahnemann has wrote these things which was not applicable today. Nobody has even wrote that we need to understand, change some kind of aphorisms. They had to be rectified, or some literature is not now useless nowadays because it was proving or it was written 200 years back. If nobody has dared this, so what is the reason behind this? The only reason is whatever Dr. Hahnemann sir has done before 200 years, before in his life, all that was pure experiments. He has never done any guessworks. He has never done any imaginary data. He has not never relied on the this such kind of concepts. Rather, he was having opinion that we must have definite results. We must have definite data. We should rely on our experiences. We should try ourselves, whatever written by himself. And we know that he how Dr. Herring was get converted into homeopathy by just reading one line, mimic me but mimic well. And he tried. When he has been asked that you should write down against homeopathy, he get converted into the homeopathy. So why it is happened? Because he tried to mimic Dr. Hahnemann sir, and he read the literature, and he himself experienced, and then he realized that yes, what Dr. Hahnemann was saying is correct. And the same thing is happening over the period of years, that many of the other faculty physicians, they get converted to the homeopathy. We are having long history of such conversions, and then they become very good followers of homeopathy. So why this is? Because our science based on natural principles. We must understand nature's principles. We must understand Hahnemannian teachings. And I think if we understand that, we are having much ample amount of literature, ample amount of drug substances, ample amount of teachings present in our literature. If we master it, there is no need to go for any other literature. At least we must try to start with Hahnemann sir. And if you feel that some lacunas are there, some deficiencies are there, then you refer more authentic literature regarding drug proving mostly. And then you think of utilizing medicals of other stalwarts. But yes, if knowledge part, if you'll ask me, only Hahnemann sir has written it correctly, completely. No stalwarts. This is a very strong statement or bold statement, I'll say. He I with due respect, considering the contribution of all the stalwarts, nobody matches the contribution of Dr. Hahnemann sir. Because the time when he has done it, when starting from the very beginning, that discovery of the homeopathy to making the science complete and perfect, he was the only person who has done it. Many stalwarts later on contributed it, but many times they have actually misled us with their understanding, with their preconceived ideas, with many tragedies like delay in publication of the sixth edition of the organon. Meanwhile, fourth edition, fifth edition practices get established. So many mishappenings are there, tragedies are there. But ultimately, if you see, Hahnemann sir and his literature is the foremost source. we must start reading it, we must start applying it, and if you feel something is lacking, then you can think of literature of other stalwarts. That's it.
Sir, I think your camera is off. Just before we end, can you please share your experience of contributing in our pharmacy textbook by D.D. Banerjee? Please share your
Yes,
experience.
definitely. So, am I visible?
No, you're still not visible. Yes, now
Okay.
we can see.
Yes, great. So, we are teaching Hahnemannian homeopathy since long time. We are conducting free classes, seminars, webinars, uh, and we are trying ourselves to propagate Hahnemannian teachings in our own capacities. But when I was reading I am actually teaching homeopathic pharmacy since more than 12 years. And I came to know that there are many concepts which is not been included in Hahnemannian literature. And I have actually contacted the BJN publishers, and I said ki, uh, there should be some modifications regarding such one topic from that what we have learned today, the doctrine of signature. What Dr. Hahnemann is saying that we should not use it, the same exact opposite things are there in literature. Even we are not aware about this. Most of the faculties are not aware about this. So I think we should start writing such kind of literature. And I just actually put a message to Sheetal madam, the chief editor, and immediately she replied, "Ki sir, we will include that in our upcoming edition. So you just send a literature article." So actually, it was unbelievable. I was not having believed that immediately they accepted the article and they were ready to publish it. And within, I think, within a 3 months, it was get published in the book fourth revised edition. So it is for me it was very astonishing. Ki BJN team has replied so quickly, and in within a span of 1 to 2 3 months, they have even published that articles in the book. So it was really a great experience of doing work with the team BJ. And another thing is that the same thing has happened again when I contacted with the Dr. Noori regarding this conduction of the seminar. I think even within a week we have planned it and conducted that webinar today.
It is
So
an
great,
honor
great
to
experience.
connect. You, teachers like you are the people that we cherish, and we want the students to keep connect. And this is the quality of education that we want to maintain, much needed for the homeopathy right now.
Yes,
And
definitely.
DD Banerjee has contributions from teachers like you, and we will continue to make modifications. And BJAN is continuously working to have people like you on board. Thank you for your contribution once again, sir. Thank you for your time today. And I hope this webinar has been fruitful. Once again, thank you, everyone. And keep watching Homeopathy 360 for more such webinars and teachings. Thank you. Good night, everyone. Thank you, sir.
Thank you very much. Thanks a lot for patience listening, having good queries from your side to all the listeners or the faculties. Thank you very much to Team BJN, Team Homeopathy 360. So thanks a lot. Have a
Thank
good
you.
night.
Good
Thanks.
night, sir. Good night.